what are the things that predict people not getting sued? So the non-sued doctor spent 20% longer. Yeah, 2 minutes. Now this was looking at physicians. So people that actually talked more to their patient got sued less. The non-sued doctors laughed more. I don't know whether they count their jokes or not. And another interesting finding is the non-sued doctor, it didn't matter how much information that you gave them, it did not predict whether you got sued or not. Now, in the literature on therapy relationships, they find, and also in the dental literature, if you give a patient a lot of information, they think you're competent. It doesn't necessarily mean that they will like you. So being seen as competent isn't enough. They actually need to like you. Does that make anyone nervous? I suppose it depends whether you're likable or not. Eh? So it was, the difference is how long they talk to the patient and the tone of voice. So someone that had a very dominating voice, patients didn't like it. Didn't matter what they were saying, if the person had a dominant tone, it predicted being sued. So it's not just what you say, it's how you say it. In the therapy literature, we call that having a collaborative stance. So you don't tell a patient what they're going to have, you discuss it with them, you engage them, and you actually talk to them rather than talking down to them. Anyone got any questions? Okay. Okay. Now the non-suit practitioner used more active listening skills. Anyone want to have a go at give me an example of an active listening skill? Patient says something, you do what?
Giving them feedback, telling them what they said, perhaps in the same words, but letting them know that we actually heard what they said, whether we read it or not.
Well done, exactly. So you paraphrase or clarify or just verbatim repeat what the patient said. Now, the non-sued practitioner, they used orientating comments. So they said stuff like, we're going to take vitamins, I'm going to chat your mouth, and then we're going to chat about the treatment that you're going to have. So the patient knew at some point in time they were going to get a chance to talk. So the orientating comments were really, really important. Okay, so returning to when things go badly, I want you to be honest. When you're having a disagreement with someone, so you're arguing, and they're stating their case, blah, 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 what are you doing while they're stating their case?
You want to think of your argument.
Yes. Thank you, Joe. Thinking of what you are going to say back. Anyone, any other things that you're doing? Other people?
I think the practitioner should reflect back, so you should paraphrase and say, how are you feeling? I can hear that you're angry about X, Y, and Z.
Perfect.
Can we talk about it?
Perfect. So that perfect examples of stuff that we'll return to, so validation, paraphrasing. So, but when we're arguing with someone, we're often sitting there thinking, hurry up. As soon as you finish, I'm going to tell you my point of view. So when you're arguing with someone, what assumptions are made by the person that's arguing with you? What are they thinking? Why are they arguing with you? Because they're what? Of course they're right. And when you're arguing with them, why are you arguing with them? What are you thinking? You're right. You're right. That's exactly what people are thinking. Now, you know, an undergraduate, when they teach you stuff and you don't actually understand the full importance of why they're teaching you, I was thinking, why are you teaching us this, that? Now, they gave us an example where they got undergraduates to rate their opinion of Fidel Castro. And then they said, okay, everyone, write an essay on Fidel Castro and based on the facts why you like him, why he's a good guy. Then they assessed their opinion on Fidel Castro again. What do you think they found? Someone that hasn't spoken, have a guess. What did they find? So they reviewed the facts of why Fidel Castro was a good guy. What happened to their opinion of him?
So who's Fidel?
He was a dictator in Cuba. Lived since 1961. It's just been, he was still,
I wasn't born.
Dictator of Cuba, his brother Raúl now is the dictator.
Thank you, Alex. So, but okay, going back to the question, what do you think they found once they got someone to write a pro-Fidel Castro essay? What was their opinion of him?
Far more favourable.
Sorry?
It was probably far more favourable.
Yes.
Because they saw him in a different light.
Yes. Now, the point they were trying to get us to comprehend was that when you make an argument, you constantly go through the facts that support your own argument. So the more you argue with the person, the more they believe they're right, because they're not listening to you, they're mentally going through their facts. So if you want to have a standoff, continue arguing, and you can guarantee that their opinion will move to a stronger opinion than they initially held. Now, Dale Carnegie's of How to Win Friends and Influence People fame said the best way the way to get the best of an argument is to avoid it. Now, that's different to attempting to resolve conflict. They're saying straight out arguing basically doesn't work. So it doesn't matter how clever you are, what points you make, the person will be thinking how clever they are and reviewing their own points. Is this news to anyone, the Fidel Castro thing and the reinforcing someone's opinion? Ah,
Yes, yes.
thank you.
Yeah.
It is interesting though, because why would you bother arguing with someone unless you thought you were right? Some people argue for fun, but okay. So arguing doesn't work, what does? So Socratic questioning and guided discovery is what they teach therapists to do. So we don't sit telling people what to do all day. We actually have working hypotheses. We ask them questions with the idea of getting them to see the fault in their own ideas. Now, the thing about Socrates is they would have their debates. So he was 400 BC, which I found pretty mind-blowing. So he would have his arguments in the marketplace, and he would ask questions of the person until it became screamingly obvious to them that they were wrong. Then everyone would laugh at the person. Now, Socrates was not popular. No one liked to be humiliated. So if you're using Socratic questioning, the aim isn't to humiliate the person, but just to get them to be really clear about what their thinking is and what the outcomes of their thinking is. So asking questions. Now, okay. So coming back to ways of avoid getting sued, how do you get people to like you? Now, as I said, this book was published a long time ago and it's still constantly, referred to. And since 2010, and probably actually a bit earlier, about 2004, they started to be a different understanding in how people thought, how to go about doing therapy, and what happens in a person's brain. So Dale Carnegie came up with these ideas, and they still stand today. So he said, become genuinely interested in other people. Who feels genuinely interested in other people? Hands up. Okay. So your job's much easier if you're genuinely interested. If you're not, and some people aren't, some of the points that if you're not genuinely interested in people for their sake, then you have to find out what their interests are and try and find common in people. Smile, remember the person's name. Who's good with names here? Hands up. Who's appallingly bad?
Oh, but we've got it on our computer, so we don't,
Right.
we don't have to keep our names.
The tip is repeat, and also try and put their name with an association. Become a good lister, find out the person's interest, talk about the person's interest. Now give sincere and genuine praise, and never criticise, never condemn, never complain. When I read that, I was like, now what am I going to talk about? So, never criticise, never condemn, never complain. And this is when you're at the stage of establishing a relationship. When you've got a friendship, you know you're allowed to complain. Right. So, the guy Howard Martin worked with this guy John Gottman as well. Now, they do laboratory-based research, and they take people and their interactions, and then they look at what works. So they scored stuff, and they found if a relationship is to work, you need 5 positive interactions to 1 negative. So 5 good to 1 bad. Now, if you're working with a patient, how might this play out? So if you want to have a good relationship, someone tell me 5 positives before you hit the 1 negative. What would the 1 negative be in a dental setting?
Final bill.
What was that, sorry?
Final bill.
That's always the bad news. So if you say your tooth needs to be removed, or you have gum disease, your oral hygiene is poor, blah, 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 all of those things, they're seen as negative interaction. Tell me 5 positive things that you might say before you get to the bad news.
Nice coloured teeth.
Very good.
A lovely handbag.
Lovely smile.
Yeah.
Absolutely. No, actually, Kat's here. When I went to Kat for my Invisalign, Kat was saying, you have lovely coloured teeth. I thought, oh, thank you, Sue. And they're nice shape. I was thinking, yeah, I thought they were rabbity, but thank you. So I got all this good news, and I'm really thinking, I really like Kat. She's so nice.
Yes.
So, but it was really interesting because I remembered the positive things that she said to me. She didn't say, yeah, you do need Invisalign, you've got a really rabbity arch, do yourself a favour. Which she could have. So the 5 positive is greeting them, saying it's lovely to see them, great that you've turned up, lovely that you've improved in your oral hygiene, I love your dress, how are your kids, blah, blah. All those things to the 1 negative. The other things that make a relationship work is the ability to resolve conflict. Now, what they found is that some marriages and relationships can go along swimmingly well until you have a disagreement. Now, if you have no ability to resolve conflict, it means the relationship fails. So whether it's a dental relationship, a physio relationship, or a marital relationship, you need to be able to resolve conflict. So we've covered the how might you give feedback to your patient based on this 5 good to 1 bad. So, becoming more skilled. Not getting sued is about being liked. So, given that 25% of the population, you just know as a rule of thumb, have high fear, and 3% have dental phobia, what sort of things might you ask trying to get the relationship rolling? Al, I might have to call on you if no one's going to volunteer. So,
Anything to make their visit more comfortable, whether that's watching a TV or an iPod or noise factors.
yeah, so distraction.
Telling them what's happening, yeah, distractions.
And so if a quarter of the population are high fear and 3% are dental phobic, what might you look for when a patient comes in? What might you notice?
Just very anxious, tense.
Yes. If you label that, hello such and such, it's lovely to see you, I can see you're a little bit shaky, what do they know?
You
Straight
care.
away.
Or
Yes.
aware of this.
Yes, that you've noticed, that you've
You
cared.
care.
Once you've noticed, what sort of questions can you ask them? So there were good suggestions coming. So you want the patient to focus on something besides their fear. What can you offer them?
Just reassurance that you're not going to do anything they're uncomfortable, that they're not happy for me to
Good.
do. Or
So reassurance, you can offer music, you can offer, is there anything that I could do that would make you feel more comfortable? Yeah, Angela?
Now I feel more emasculated.
We can have a time.
Well, if you wanted to emasculate someone that was anxious, what would you say? How would you have to say it to make them feel that way? Do you think that's likely coming from you? Highly unlikely.
I didn't hear that, but
Angela said if you give them feedback noticing that they're anxious, will you make them feel emasculated? I said, is it likely Angela will make anyone feel emasculated? With their charming, gentle manner? Unlikely. So if you say things that it's great that you're here, it seems that you're a little bit nervous. Is there anything I can do to make you feel better? Do you need a glass of water? And I always ask a patient, is there anything that you want to actually ask me? Is there anything that you could ask me that might make you feel a little bit better? Have you been doing this long? Do you know what you're doing? All those type of questions. Are you going to just do what you like? So getting them to ask a question. Now, if they've seen 20 dentists before, I would actually be asking, and what went wrong? What happened with your last dentist, as I mentioned before? So you give them the opportunity to talk about it. If you give them the opportunity, how does that make you different?
Because their concerns are being voiced, so their concerns are being validated.
Yes.
You're listening to them.
Yes. So, in terms of being assertive, so in just chatting with the patient, okay, so assertive statements are I think, I feel, I prefer. We'll sort of come back to this when we're looking at conflict resolution. Now, assertive communication, so you use I statements and you make them brief. Now, there was a book by Chapman in 2010 on the languages of love, and they said, on average, you've got 18 seconds of talking before someone interrupts you. Anyone find that interesting? I assume that's just in a social setting, like as a clinician you get to pin them down and keep on talking. But keeping it brief is helpful. So aggressive communication is concerning the wants of the speaker. So it's like, once someone gets aggressive, it's you're difficult, you need to sit still, you need to comply, so you. So passive communication, at one of the, at the last lecture, someone said, I hate dealing with passive people. What do you think their problem was? What's the problem with dealing with someone that's passive, even if it's the patient? What do they do or not do?
you don't get no feedback.
Yes. No feedback, no opinion, so you sail on merrily doing what you want, assuming that's what they want, and then they go away and they can plan. So trying to get that collaborative input from them, because otherwise they told me I had to, I felt I had no choice, they railroaded me. So aggressive people, at least you know what you're dealing with. Right? They're in your face and it gives you the opportunity to resolve it. Passive people just sneak off quietly and complain about you.